Objectives. Primary objectives: to determine the prevalence of resistance to first-line anti-TB drugs among newly diagnosed sputum smear positive TB cases. To determine the prevalence of resistance to first-line anti-TB drugs among previously treated sputum smear positive TB cases. The secondary objectives: to determine the prevalence of second-line anti-TB drug resistance in MTB strains with confirmed resistance to isoniazid and rifampicin. To describe drug resistance patterns of MTB strains collected from newly diagnosed sputum smear positive TB cases. To describe drug resistance patterns of MTB strains collected from previously treated sputum smear positive TB cases. To determine the proportion of HIV, treatment type and source of retreatment among enrolled patients. And to strengthen routine surveillance of anti-TB drug resistance. Sample size. For the NDRS survey, there are 120 TB units that have been selected from all over India by appropriate sampling technique. A total of 5,280 patients would be inducted into the survey. All diagnostic centers under the selected TB unit will contribute the cases until the cumulative number of 27 new cases and 17 previously treated cases are registered from each of the TB unit. Patient inclusion criteria. Newly registered sputum smear positive pulmonary TB patient with no history of prior treatment for TB or a history of anti-TB treatment for less than 30 days are included in the study. Please remember that such enrolled patients shall not have initiated a course of anti-TB treatment. Registered patients with sputum smear positive pulmonary TB with a history of previous TB episode with more than 30 days of anti-TB treatment may also be included in the survey as previously treated cases. This may include relapses, treatment after default, treatment after failure, or other patients who have claimed to have anti-TB treatment for greater than 30 days. Such enrolled patients shall not have initiated a course of anti-TB treatment for the current episode. Patients meeting the inclusion criteria but who cannot be included in the survey for various reasons will be replaced by other patients diagnosed in the same TB unit according to the inclusion procedure described. Patient exclusion criteria. The following types of patients are excluded from the survey. Newly registered cases with sputum smear negative pulmonary TB, patients with exclusively extrapulmonary TB, patients diagnosed at a correctional facility like prisons, asylums, persons who are unwilling or unable to give informed consent.